Happy learning, everyone. I am Sunshine Rojo from BSN 2A, and today we will be discussing an essential component of maternal health care, the preoperative teaching in cesarean delivery. Cesarean section, or the C-section, is one of the most common surgical procedures performed worldwide. Whether planned or performed as an emergency, a cesarean delivery involves not only surgical precision but also comprehensive patient preparation to ensure the best possible outcomes for both mother and baby. So in this session, we will explore how clear communication, compassionate care, and practice preparation can turn uncertainty into confidence. From fasting guidelines to emotional support, we'll cover what every mother needs to know before stepping into the OR. So let's dive in and learn how we, as healthcare providers, can make cesarean birth a safer, calmer, and more informed experience. So preoperative teaching in cesarean delivery is aimed at acquainting woman with the cesarean procedure and any special equipment to be used so she is informed as possible. Before we begin, in any teaching with a woman scheduled for a cesarean delivery, we have here three essential steps on how we can effectively prepare our patient for a scheduled or possible cesarean delivery. So our first step is assessing prior knowledge. Second is immediate preoperative teaching. And third one is teaching for post-operative recovery. So our first step will be assessing prior knowledge. So before teaching begins, we always should assess how much the patient already knows. So, for example, a woman having her second cesarean delivery may recall many details from her previous experience. So, still, she will likely benefit from a refresher and clarification. So, para magawa natin yun, we should answer all the question thoroughly. Also, we need to fill the knowledge gaps clearly and simply. So, after we assess the prior knowledge of our patient, we then need to fill the knowledge, yung mga hindi nila alam, yung mga nakalimutan, for a refresher and clarification. So, para then clear and simple yung pag-explain natin sa kanila and pag-answer ng mga question, we should avoid using medical jargon. So, terms like NPO or non-per-orem may confuse patient under stress. So we also need to keep all information accurate and easy to understand. So next step would be the immediate preoperative teaching. So patient should be informed also of all immediate pre-surgical procedures. So this includes yung paggamit ng mga surgical skin preparation, yung fasting requirements, noting by mouth for a specific period surgery. So ito na yung sinasabi natin na non-per-orem. Also, the pre-medication if may order si doc and transport process to the operating room para naman hindi sila mabigla the moment na itatransport natin sila from ward to the OR. So, they should also be told what to expect with necessary procedure like paglagay ng indwelling urinary catheter para hindi sila mabigla and also paglagay ng IV fluid site or IV fluid administration. Also, pagbigay ng epidural catheter placement if may order for pain relief or anesthesia. So next po would be the teaching for post-operative recovery. So even before surgery, it is still essential to discuss post-operative activities that help prevent complication. So now, bakit need natin magbigay ng post-operative recovery teaching in pre-operative teaching kay mother? So kailangan natin, for this will serve as a heads up, kumbaga, parang nire-ready na natin yung emotional side ng mother kung ano yung mga bagay na makakatulong sa pag-recover nila. So this also reduce anxiety and stress to what must be done for some situations na may encounter or ma-feel nila. So a part of this includes the deep breathing exercises, the incentive spirometry, the turning in bed, and the ambulation. So let's start with the breathing exercise. So breathing exercise, deep breathing prevents mucostasis in the lungs. So deep breathing iniiwasan niya yung risk for respiratory infection such as pneumonia. So, para maiwasan yung respiratory infections na yun, we need to teach the mother or the patient to take 5 to 10 deep breaths per hours, inhaling fully, holding briefly, and exhaling completely. We also need to warn her about hyperventilations if nag-exhale siya too quickly or hindi nakakahinga ng maayos. So, next one is the incentive spirometry. So, introducing the incentive spirometry, ang incentive spirometer po, siya yung device na ginagamit post-operatively to encourage lung expansion. For example, yun nga, nagkakaroon ng hyperventilation, may DOB si mother or difficulty of breathing, yun, gumagamit tayo ng incentive spirometer. We also need to explain if gagamit man ito of yung mga function kasi most models are inhalation based, not for exhaling. The device often includes goals and awards. For example, yung mga bola or balls rising or lights blinking, which is nakaka-help siya sa pag-motivate ng paggamit nito sa patient. The third one would be the turning in bed. So we need to stress the importance of frequent turning to prevent respiratory and circulatory stasis. We need to assist them in turning techniques if needed, especially while managing incision pain. So since post-operative sila, hindi pa sila masyado capable na for turning techniques kasi nga from post-operation pa sila. And the last one would be the ambulation. So early ambulation is key to stimulating lower extremity circulation. So movements help prevent edema and blood clots caused by pelvic surgery. So para maiwasan yung edema and blood clots and proper circulation ng extremity ng patient natin or ni mother from post-op operation, we need to encourage walking as soon as the epidural wears off despite discomfort. So kahit paunti-unti, hindi naman yung biglaan, paunti-unting lakad, for this will prevent edema and blood clots. So in conclusion, effective preoperative and early postoperative teaching for cesarean delivery, yung mga na-discuss natin, includes assessing the woman knowledge and emotional state. We also need to explain procedure in simple and clear terms. We also need to teach key exercises and early mobility techniques, yung na-discuss natin na 4. The turning in bed, ambulation, deep breathing exercise, and the use of yung incentive spirometry. Also, last one is the use of visual tools wisely and compassionately. Sa pag-explain ito, and yung visual tools yung magiging katulong natin para maintindihan ng patient yung mga i-discuss natin, yung ipapa-intindi natin sa kanila. So this preparation not only improves outcomes but also empowers the woman with knowledge and a sense of control during one of the most significant experiences of her life. So that would be all po. Thank you for your attention.